Back live on Fox 4 News at 9. If you're more active during the summertime, and I think all of us are, right? Well, we got some ideas. Listen up here. Activities like softball, tennis, and golf. Yes, golf can lead to joint injuries. Here today to talk about preventing those injuries, we have Dr. Charles Orth. He's an orthopedic surgeon with North Kansas City Hospital. Good to see you, Dr. Orth. Welcome in.
Thank you. Good morning.
You know, I myself here, I've got I don't know if it's an injury or not, but it's definitely joint pain in my right elbow, and I think it's from playing golf. And let's start with just the first thing here. What can we do to try to help us prevent injuries during the summertime when we're more active?
Well, we know the data shows that 30% of all musculoskeletal injuries show up in a physician's office. So the three things that I tell patients, and we want to let everybody know, is number one, go ahead and wear the proper clothing. That includes protective gear if it is with your sport. Go ahead and wear right shoes for the sport, because your shoes are the foundation that support the ankles, the knees, and the hips above. So that's very common sense. The second thing is hydrate when you're doing physical activity. In the summer it's a lot hotter, so don't forget at night before you go to bed, take an extra glass of water. That builds your fluids up in your body, you're ready the next day, and avoid caffeine the day that you're going to exercise. That will deplete your water. And the last thing is with throwing sports, racket sports, work those shoulder muscles. Get them a little bit looser. With the walking, the jogging, those type of activities, stretch the leg muscles, make them stronger. But the best thing everybody can do with all sports is work on your abdomen and your core muscles. That gives you a great sense of balance, a great foundation that your body might be able to respond better to an injury.
Yeah, and those exercises would include like planks, maybe sit-ups, maybe side planks.
Absolutely, those are correct.
All those would be good. All those ones that you don't like doing. What if somebody is thinking about starting any physical activity? What should they consider?
So the first thing to do is remember the 10% rule. I tell people whether it's tennis, walking, jogging, running, don't increase that activity by more than 10% a week. That way your body gets a chance to recover. And 10% could be 10% more of time in the activity or 10% more of miles that you might be running, but use the 10% rule. Likewise, if you don't know what kind of shape your body is in and you're just starting out and you're fearful, don't forget the primary care physician might need to give you a good physical going over that can help you answer that question.
So doctor, we've gone over our 10%, okay? We've thought we were going to try to make up for the days that we didn't exercise the day before. And all of a sudden we've got, that does that. When should we go see someone like yourself?
The first thing that we would like everybody to do, if it's a contact injury and you definitely have a problem, sure, come in and get consulted. But for the majority of injuries, remember that acronym RICE, which means resting it, icing it, compressing and wrapping it, and elevating the extremity. If you've done the RICE technique and done that for a good 3 days and you don't see any improvement whatsoever, it is probably time to come in and get consulted.
Okay. Dr. Orth, great to see you. That's some good advice.
Than's so much.
You bet.
Appreciate it.
Good to see you. To learn more about orthopedic services available at North Kansas City Hospital, visit nkc.org/ortho.